Hi everybody, I'm Dr. John Flannery, and today we're going to be doing the positive, principled, practical way of examination for someone who has fibromyalgia. So today we have Penelope, and she's going to demonstrate with us the proper examination technique to make sure that you've got clarity in your diagnoses. So thank you, Penelope. And first I'll get you just to stand for me, and I'm going to walk through the different components of the examination.
There are 5 components to this fibromyalgia exam, which will be demonstrated by Dr. Flannery in this video.
So first off, we do the first phase, which is the inspection. And the inspection has 3 components to it. We want to look at her from front on, from the side, and from behind. So first off, if you just turn a little bit towards me, Penelope, I would like to look at you generally. And so when I'm doing that, I'm going to look at her head, make sure her shoulders, arms, and legs are all in the normal and anatomical positions. So can you just lift your sleeves slightly up your arms? Excellent. Hold your arms out. And as I'm doing this, I'm inspecting, looking for the muscle bulk of her forearms and her arms, as well as her hands. Now can you just turn your palms up? And again, I'm now making sure that there's symmetry between both of the arms, both of the forearms, and the muscle bulk in her hands is quite reasonable. And they are. You can put them down. Can you now lift your gown to just mid-thigh? Now I'm looking for the muscle bulk of her thighs and of her calf and of her feet. And you can see that there's nice symmetry in that inspection anteriorly. I'm going to now get you to look sideways. And so at this point in time, we can open up the gown just slightly so that we can get a good sense of her thoracic and thoracic and lumbar spine. So at this point in time, what I'm looking for is where her alignment for her ear relative to her shoulder and pelvis and malleolus or ankle bone. And you can see that there's the normal cervical lordosis as well as the normal lumbar lordosis. That's an excellent alignment, and you can see that her ear is actually right over top of her malleolus, indicating good posture and nothing to be concerned about with any muscle imbalance. Lastly, if I can get you to just turn, I will look at Penelope from behind. And at this point in time, I would usually put my hands on her pelvis to sort of see if her pelvis is square. Notice the dimples of Venus to sort of see where they are, which is right over the sacrum, as well as now look at the symmetry of her gastrocs and of her thighs. And everything seems to be very much intact. So we'll just get you to turn and face me, and I will now tie that back up. The next component, now that we've got the inspection, is to look for a little bit of her gait and management of her gait. Okay, so now we're going to look at the gait component of the examination. So I would ask Penelope to walk 3 steps back and forth so I can assess her overall balance. So we just walk. The width of her base of support, and I can see that she's turning very smoothly, and there's no wideness to her base, indicating that her balance is really quite sound. At this point in time, I'm now going to do some more motor testing to give a good sense of how her strength is. So now, Penelope, I would like you to walk on your tippy toes, just in front of me here. 3 steps, and then 3 steps back. That gives a very good assessment of her overall strength for her lower segments of her lumbar and sacral area. Now I'd like you to walk 3 steps on your heels. And again, she's demonstrating excellent strength. Good. And good balance. The last bit of the power exam will be looking at your pelvic area and your quads and hamstrings. So I'd like you to put your hands on your hips and just do a deep squat down like that. Any difficulty or pain when you do that?
No.
Excellent. So that completes our sort of quick screen for posture and overall inspection, as well as our ability to look at her overall gait and balance. So now we're going to progress to the range of motion of her upper extremities. So Penelope, I'm going to ask you to do different motions. You tell me if there's any pain or discomfort. So first we're going to look at the cervical spine. So for this, I'm going to ask you to look at the ceiling as far back as you can go, and I'm examining and looking for that motion, which is excellent. Now bring your chin forward and touch it to the chest. Excellent. Back to center. Now look over your right side. Now look over your left side. I'm examining her and watching for the pain or discomfort. Lastly, bring your right ear to your right shoulder and left ear to the left shoulder. You can see that she demonstrates excellent range of motion, which tells me that that area is free of any pathology or pain. Next, we'd like to look at your lumbar spine. I've already inspected that area, so I'm going to leave the gown in its usual fashion and just look for the range of motion. So just turn a little bit towards me. Can you bend forward and try to touch your toes? She's demonstrating excellent range of motion. Come on back up. Any pain or discomfort as you did that? Lean back as far as you can go. Excellent. And again, you can see she's demonstrating good range of motion. Take your left hand and slide it down your left side. Now I want her to do the same on the right. And then lastly, for rotation, I want her to cross your arms over your chest, and I want you to spin and turn and look at me. And now do the same on the other side. So we can see that she's got very good rotation all around through her lumbar spine. Now lastly, we can look at her. Come and face me, please. I'd like to look at your upper extremities. So I'd like you to bring your arms up over top of your head and behind the small of your back, and now in the small of your neck. Did any of those motions cause any change or pain?
No.
No? Okay, so that tells me that she's got good range of motion for her shoulders. Now I'd like to look at your arms. So bring your arms up like this at your elbows. Bring your arms out. Put your hands together. Bring them out. Now put your hands together this way and bring them down. Is any of those motions causing any discomfort? So we've cleared for her elbows and her wrists. Lastly, your fingers. I want you to bring your fingers down like this. Now make a fist. And now open them up wide. So I've seen good range of motion of all of those joints. We'll do the lower extremities in a few minutes, but first I'd like to now transition into the power assessment for our upper extremities to make sure that we have good assessment if there's anything abnormal about her motor control. So if you could have a seat for me. I'm going to ask you to do different areas of strength, and I want her to resist those activities. So with your arms slightly bent, I'm going to be testing her biceps, her C5 and C6 myotome. Resist, excellent. She's got good strength on both of those. Put your arms straight. Now I'm going to be testing her triceps, C8 and C7 muscles. Again, she's got excellent strength. Put your arms bent. I'm going to look for supination or for pronation. So resist me turning your palms up, supinating, or turning your palms down, pronating. Don't let me turn your palms down. Good strength. Bring your wrists back like that. Here is C6 strength. Excellent C6 strength. Now bring your wrists down. And again, we're looking more at our C7 area with strength, and all is very good. Lastly, can you squeeze both of my fingers very hard? I only give 2 fingers so that I can't get any real pinching going on. Thank you very much. That's good strength. Lastly, open your hands up wide, and don't let me squeeze them together. Good? Good strength. Make circles like that. Don't let me break the circle. So now we've gone and established very good strength in all of her C8, T1 muscles of her hand, as well as the muscles of her arms and forearms. That allows us to now go into doing reflexes. So we're going to get a reflex hammer. And for this, I usually like to make them nice and relaxed, have their arm draped over mine, and I'm going to look at her segmental level, C5, 6 right here. And although you can't see the biceps exam, you can feel it. I've got her biceps tendon right underneath my thumb, and I'm going to gently tap that, and I can feel the reflex underneath. And you can see she's got a nice symmetric reflex of her C5, 6 biceps. Still holding her arm, I can get her in for her triceps examination, which is C7, C8. You can see there's quite a good motion there. Brachioradialis, just by placing her hand here, we can see that her wrist gives a nice little reflex there, and that's helpful for us to know that the C5-6 is again functional. This reflex here is a pronator, and so by tapping on her wrist, her C7 is functional. I'd repeat the same on the other side, but we've already got it established that those are the things that we're looking for. Last exam here would be to cup her fingers, and what I'm looking for here is the C8-T1, and you can see them contracting underneath. One upper motor neuron find we're going to look for is the Hoffman. And so with that, we want to have the long finger firmly fixed so we can have a quick flexion of the distal portion of that. And we're looking for her thumb to contract through the IP joint of her hand. So in this position, I'm going to quickly flick, and I'm watching to see if there's any movement. And there's no movement happening. I'll check on the other side in the same fashion. I've got her thumb present here, and I'm forcibly flexing her long finger, and I'm not seeing any of it. So she has negative Hoffmans bilaterally. Now we're going to progress to her lower extremity. So Penelope, I'm just going to tap your patellar reflex, hitting your knees, tapping your ankles, and then your hamstrings. So this reflex right here is L3-4, and you can see there's a slight reflex, and the same on the other side. We're looking for these reflexes. They're mainly to be symmetrical, meaning that each side is about the same, and we got that on this case. Now we're going to move down to the S1-2, and again, we're just going to gently dorsiflex her foot, and I'm just going to slightly tap her Achilles tendon, and we've got equal and nice reflexes on both sides. When I do the hamstring, I usually cup the individual's leg with my knee, grab her medial 2 hamstrings, and then tap her hamstring with my fingers over top of it. I can feel that contracting. I would do the same on the other side, looking for symmetry. A nice way to remember these reflexes are to actually count them out. So S1-2, L3-4, and L5. 1, 2, 3, 4, 5. If we carry on counting, we can go up and do 5, 6, 7, 8. So that's an easy way to remember the majority of reflexes that we're looking for abnormalities on. Now that we've finished the reflexes, we're going to do one last upper motor neuron find, just like we did with the Hoffman. We're going to look for the Babinski. So for this, we're actually going to tickle the bottom of her foot, so this might tickle a little bit. And at the same time, I've just done a straight leg raise, where she's got her leg looked in at a 90-degree angle, and we've tethered any of her nerves that might be risky or, had some discomfort. So we're now doing the Babinski. And you can see it has quite a pronounced reflex, and some people find it ticklish. The toe goes in a downward motion, and again, she's got a normal reflex. I did both sides for the SLR, straight leg raising, and there was no pain. So I quietly did a special test looking for her straight leg raising or tension of any of the nerve roots, as well as the Babinski. So now we're going to progress to the sensory component, and that's one of the most critical aspects. So we've got a couple of modalities that we look for. And I'm just going to demonstrate exactly what these are with some tools. A cotton swab and a Wartenberg pinwheel. If this is a bit expensive, you can have the poor man's version, which is basically a tongue depressor, which we would break into half. And now we've got the prickly component that we'd have with the pinwheel. We've got it right here that we can do a sensory exam on. What's important for me is to explain to Penelope exactly what we're looking for. So I'm going to ask her, you've felt a cotton swab before?
Yeah.
And she knows what a cotton swab feels like. In an area that she doesn't have any pain, I'm going to say, did that feel like you would expect? And does that feel like it? So that's what we're going to be measuring on you. If that's a 2, if it's a little bit less, that would score you as a 1. If you can't feel it at all, that would score you as a 0. So that's what I'm looking for. If this cotton swab, which is non-noxious, causes pain, that would be a 3. So I want you to communicate to me what that is so that we can do a complete assessment in a timely fashion. So if we start here and we know that this area is not painful, I want you to close your eyes and tell me if this feels like it did originally. So that feels the same. Is there any difference or completely different feeling as we go across these different areas? Do they feel the same?
Same.
So what we're looking for is that the light touch had no difference. While we're in this area, I'm going to go up and do our Wartenberg pinwheel, which is a noxious or slightly painful. So you can open your eyes. Penelope, when you feel this, it's a little bit prickly?
Yes.
So what I want her to do now is tell me, does it feel the same prickliness, which would be 2, or is it really quite tender, which would be a 3, or not feeling it as much at all, which would be a 1, or nothing whatsoever, which would be a 0. So now close your eyes again. Here's that first feeling, and you can feel that feeling. Is it the same here on your face?
Yes.
Is it the same here on your neck area?
Yes.
So with that process, we are now going to quickly screen the rest of her body. So can you lift your arm sleeves up to cover your shoulders? We're now going to carry on with this examination over a very large territory that have multiple peripheral nerves and multiple dermatomes. So now we reestablish, and now we can go through a greater number of areas. That always feels the same as it did on your forehead.
Yes.
And same as, let's say, on your neck.
Yes.
We can go to different areas of her arm, of the front of her arm, of her other arm, and the side of her arm. All of those feels about the same?
Yes.
Exactly the same?
A 2.
Now we can go into the hands, which are a slightly specialized area, and we're going to do the same component. We're going to look at this area versus this area. And these are the ulnar versus the median nerve. Do they feel like they did on your forehead?
I think so.
Okay? And similarly here on either one of your hands. So now we've covered multiple dermatomes and multiple peripheral nerves. We can now move on to our pinwheel. So once again, you can open your eyes. I've got the little pinwheel. Close your eyes. That feeling, can you feel that on your arm as it goes down? And now I'm going to, again, travel multiple territories. And I'm establishing, did this always feel like that too?
Yes.
So it was normal, no difference. We tried not to lead the witness or put words into their mouth. So did this feel similar to here? And we give a couple of examples.
Yeah.
So now we're establishing that she has a completely normal upper extremity and facial area. It's important for us to examine the back because sometimes people have areas of discomfort. So we're going to look to see if there is any sensory abnormalities during that time. So Penelope, if you can kindly swing over and face the back. And now for proper draping, I'm just going to make sure that we can have this area appropriately exposed. If you can undo that little band there. So now we have excellent exposure of her spine, and we're going to do the same thing once more with our light touch and our pinwheel. Reestablish the sensation. So Penelope, you can feel this feeling here. Please close your eyes, and I want you to tell me if it feels the same. So we've gone down into her neck, through her back. They might find this ticklish a little bit because it is a light touch, and this isn't a common area. Was there any abnormalities in that feeling down in there?
No.
Okay. And if 2 was normal on your forehead, what number would you give the back that I just assessed?
2.
Okay. And now we're going to carry on and do the same down here. Again, it may be a little bit ticklish. How did that feel?
A 2.
Okay, so now that we've established that that's the same feeling, I'm just going to make sure that we cross areas where people have discomfort, like in their cervical or the lumbar spine. So we're going to compare one side to the other, going across here.
2.
And again, I'm crossing midline to see if there's any significant difference. And it's not painful, okay? And then similarly down here, and again, since that response has come along, I might find it similarly, but it's not painful. And so that gives us a good sense that there is no allodynia or extra pain with a non-noxious stimulus. Now we're going to do the Wartenberg pinwheel, and again, reestablish that little prickly feeling. Now we're going to do the same down here through her back and her spine. So this prickly area, and just making sure that's not tender or painful, it's simply ticklish. And then how would you rate that? If 2 was on your forehead, what number would you give it here?
A 2.
Again, same territory down through your back, and again, we're getting this real ticklish response, which happens sometimes. What number would you give it there?
A 2.
So once again, now we're looking for any change from one side to the other. And again, people often have pain in their shoulders and necks. And so we're establishing that there's not any extra pain established through this area. Again, Penelope has quite a ticklish response, but the good news is that this is not painful, it's simply ticklish. Is that correct?
2.
Okay, so now we're going to progress to examination of the lower extremities. So we're just going to regown you here. I'll get Penelope to lie down on the plinth, and we're going to finish the lower extremity component of the sensory and some special tests. So with our towel here, we can make sure that the draping is appropriate. So I'm just going to spread this out because I'm going to need to have your thighs exposed. If you can lift the gown up so we can maintain some dignity, but I do need to go up to these upper regions here of the thigh so that we can get many of the dermatomal levels. So once again, in the same fashion, just reestablish, close your eyes. You can feel that feeling. That feeling is a 2. I want you to tell me if there's any difference that goes on. So as we go down large territories, how did that feel?
2.
Excellent. And down here, again, with our light touch.
2.
So we're not having any significant changes. Again, and I would do it in multiple sides to make sure that there's no changes for over the lateral part of the leg or for the inner part of the thigh. And again, how did that feel?
That's the same. 2.
So because we're having the same response, always normal, that allows us to move on to the next modality, which is the pinwheel again. So we reestablish how she feels. So close them. That feeling, I'm now looking for on your legs. Again, we're covering lots of territory. How did that feel?
2.
Similar feeling all the way down? Mm-hmm. Between the two toe spaces is L5. How did that feel?
It's normal.
Okay. So now that we've completed the sensory exam, there's just one other component that we need to look for, and that is to ensure that we're not missing a peripheral neuropathy. So with our tuning fork, we're going to examine and ensure that she has good sensation of this. So this is a vibratory aspect. So first I'm going to test this on Penelope's collarbone. So tell me how this feels. Can you feel that?
I can feel a vibration.
Right. Excellent. So now we have established what the sensation is. We're now going to do it on her big toe. So I grab her big toe. Can you feel that? Can you tell me when it stops?
Stop.
Okay, good. And I can feel through my finger that vibration, and it was starting to fade. I would do the same on the other side. And with this last test, we can actually demonstrate that she does not have a peripheral neuropathy, because this is the most sensitive test that we can look for. So now we're going to move into the palpatory exam and the range of motion. So first, we're going to have you lift your leg and bring your knee up onto your chest. And you can demonstrate that she's got excellent range of motion. I'm just going to do external rotation and internal rotation. Any pain from that? Her knee is good and flexed. And now I've got full extension. And then we're going to work on her foot. Bring your toe towards your face. And now push down on the gas pedal. And no pain demonstrated and good range of motion. Do the same on this side. So we've got excellent range of motion for her hip, deep flexion. We've got external rotation and internal rotation. And now we've got full extension of her knee. And she's very good range of motion. And now bring your toe up towards your face, bring your foot down towards here, and she's demonstrated excellent range of motion. So now, this area I'm gonna palpate can be quite painful. I'm gonna start with the lower extremity, so you just make sure that you let me know if there is any pain. It's important to communicate that because Penelope needs to be in control of this part of the examination. So you tell me if there's too much discomfort. First, we're going to examine her pelvis so we can have one just establish the landmarks on her body. So here's the top of her pelvis, and that tells me where her pelvis is, and now I can palpate certain muscles. Her trochanter is just below this area, and in between those two are some really important muscles. But first, we're just going to palpate her trochanter, and there's no pain. Now I'm going to palpate through her gluteal muscles, and watching to see if there is any discomfort, and she's not noticing any. Now I'm going to palpate through her thighs and hamstrings to see if there are any discomfort in that area, and we're not noticing any discomfort when I palpate through these, which is excellent. And then lastly, we're going to palpate through her calves. And again, not finding any areas of discomfort. So that's a quick screening exam for the palpation of the lower extremities. I would now like to examine her upper spine and neck area. So first we need to reposition yourself. So if you can just pull down your gown so you can maintain proper gowning, and then sit up for us, please. To sit over the edge here, perfect. Now with her in this position, I'm going to just ungown, and I'm going to make sure that we can examine her neck properly. So can you just rest your head in my hand? And I'm now going to palpate through her cervical spine, looking for some of these tender spots or trigger points. And now that I'm not finding any of these, I would then reposition her again so that I can look at her back properly. So can you just swing over the edge? Now that we've finished the cervical paraspinals, I'm going to examine the common area, the trapezius, and all the muscles of the scapula to make sure that we're not having any discomfort in that. So here, again, we're trying to find some areas of discomfort, and we're going to be asking constantly. So right here, there's a little bit of discomfort. Can you feel that little spot there?
Yeah.
Is that one of your common painful areas?
Sure.
And we palpate over here. I'm not finding as many. So this palpatory exam is to identify her areas of tenderness and reproduction of her pain. I would do a similar fashion down in her lumbar spine by palpating these muscles here, like her quadratus lumborum or her paraspinals. Since we are not finding very much in the way of pain, it's now an important aspect for us to communicate back to Penelope what the findings were. So Penelope, if you can sit back over here. So Penelope, the good news is that we didn't find anything unusual about your examination. So communicating that aspect is really important. There is no sensory changes. There are no features of hyperpathia or allodynia, which are common that happen. We were not able to find any odd restricted range of motion anywhere in your body. And your complete examination tells us that you've got a very healthy neurologic system and musculoskeletal system. So we're really reassured by that full physical examination. I hope that this instructional video was helpful for you and that you'll be able to manage your patients more effectively in the future.
This video is brought to you by Echo Chronic Pain and Opioid Stewardship at UHN. To find out more and explore resources available to you from this program, please click on the link below, visit our website, or scan the QR code.